Perfect. All right. Let's see. All right. So, how many times have you been in a public area like a building or a park and have to put up with some guy blowing his cigarette smoke and foul breath in your face? Or even worse, how many times have you seen some lady at a stoplight smoking away with a child sitting in the back seat of a car, windows up? Did you know that even breathing in low doses of cigarette smoke can increase one's risk of heart attack? That's according to Dr. Myers, Professor of Cardiology and Preventive Medicine, University of Kansas School of Medicine. Even more, Surgeon General's report released June 2006 states that some 126 million non-smokers are exposed to secondhand smoke every day, what the Surgeon General Richard Carmona repeatedly calls involuntary smoking. That puts people at increased risk of death from lung cancer, heart disease, other illnesses. I have 3 very active kids, so this is always a concern of mine. They spend a lot of time at the parks, playgrounds, movie theaters, game arcades, to name a few. So I'm always concerned when I see someone standing 2 feet away from a daycare or a library, puffing on a cigarette, and in midsummer. We can just imagine it's worse in the wintertime. There is a never-ending chain reaction of health effects and financial problems associated with secondhand smoke. The only logical answer is a total ban on smoking in public places. I will expose the health and financial risks associated with public smoking, give substantiated statistics, and introduce you to laws associated with the no smoking ban. People may argue that smokers have just as much a right to smoke in public as they do in their private residences. Even more, they will suggest that we be segregated if we do not want to come in contact with your smoke. Well, I'm here to tell you, smoking is optional, whereas breathing is not. Therefore, proponents say smoking bans exist to protect breathing people from the effects of secondhand smoke, which include an increased risk of heart attack, cancer, emphysema, and other diseases. Separate smoking sections don't cut it. Only smoke-free buildings and public places truly protect non-smokers from hazards of secondhand smoke. I have been in airports and restaurants with separate smoking sections, and believe me, there is no relief. I can still smell the smoke oozing down the hallways, sometimes even up to 20 feet away. Now imagine all these toxins building up in that building all year. Not because you don't smell it doesn't mean it's not killing you slowly. Moreover, there is no risk-free level of exposure from someone else's drifting smoke, declares the report. Outdoor smoking, like in parks, on sidewalks, at bus and train stops, even from in front of buildings, is just as bad for non-smokers as smoking itself, especially the elderly, young kids, and people with health conditions. Separating smokers from non-smokers, cleaning the air and ventilation systems don't eliminate exposure to secondhand smoke. California health officials estimate that secondhand smoke kills about 3,400 non-smokers annually from lung cancer, 46,000 from heart disease, and 430 from SIDS. 46,000 from heart disease, 430 from SIDS, and 3,400 from lung cancer. Carbon monoxide is an odorless, colorless gas that is a byproduct of cigarette smoke. You don't always know you're being affected by secondhand smoke until it's too late. Secondhand smoke can act as on the arteries so quickly that even a brief pass through someone else's smoke can endanger people at high risk of heart disease. Don't ever smoke around a sick relative, not even outside. Some will even argue that they are not able to be productive at work unless they are properly accommodated with smoke breaks and smoke sections. Workplace smoking restrictions not only reduce secondhand smoke, but discourage active smoking by employees. Public smoking bans had a stronger effect in reducing heart attacks among women and younger individuals, which may be explained in part because younger people tend to frequent clubs, restaurants, bars, where smoking is a likely part of the social scene, says Dr. Myers from the report. According to a Washington Post article released September 2010, There's a good evidence that comprehensive smoking bans, like those in New York City and Boston, don't economically hurt the hospitality industry. Heavily exposed people, like those working in the entertainment or hospitality industry, are likely to get the greatest benefit from smoking bans. Appearance is everything. In the corporate world, and no one wants their employees sitting in an important business meeting smelling like a chimney. What about schools, libraries, and kid-friendly zones? I know about my children's teacher sitting in the classroom smelling like burnt tar, with all the toxins floating around the room, contaminating the air. So, we've discussed how and where non-smokers come in contact with secondhand smoke. Now let's talk about the health effects and financial effects of secondhand smoke on individuals and society. I know it's your life and you can smoke if you want to, but did you ever stop to think about the health effects and financial burden you incur on the government and everyone that comes in contact with your secondhand smoke? According to projections by the American Journal of Cardiology, September issue 2009, a nationwide ban on public smoking could prevent as many as 154,000 heart attacks each year. These findings are particularly important in light of mounting evidence that secondhand smoke exposure is nearly as harmful to the heart as chronic active smoking. Dr. Myers adds that smoking remains the leading preventable risk factor for heart attack. Secondhand smoke is thought to increase the likelihood of a heart attack by making the blood sticky and more prone to clotting. The American Journal of Cardiology researchers find that smoking bans can reduce the number of heart attacks by as much as 26% per year. A nationwide smoking ban would save more than 90 million and significantly reduce hospitalizations from heart attacks, according to a Henry Ford hospital study. After analyzing data from 13 states that don't have a law banning smoking in public places, researchers from the Henry Ford hospital study concluded that more than 18,596 fewer hospitalizations for heart attack could be realized from a smoking ban in all 50 states after the first year of implementation, resulting in more than 92 million in saving in hospital costs for caring for those patients. A national workplace ban on smoking in Ireland resulted in an 83% reduction in air pollution in pubs, an 80% decrease in airborne carcinogens for patrons and staff, and an improvement in the respiratory health of bar workers, according to Dr. Lou Clancy, Director of Research Institute for Tobacco-Free Society in Dublin. Fiona Godfrey, European Union Policy Advisor at the European Respiratory Society in Brussels, wrote, "If all European countries were to adopt a similar policy that in Dublin, she estimates that between 5 to 10 million premature deaths from smoking could be prevented over the next generation." A study conducted by the researchers in Dublin found that emergency room admissions due to respiratory illness dropped significantly in Ireland after the implementation of the workplace smoking ban, compared to admissions that took place before the ban went into effect. So now we have examined research done by numerous credible sources, and it's clear to see that a ban on public smoking has had great effects on the economy and the health of individuals alike, saving the healthcare industry millions a year and saving you from repeated trips to the emergency room. So, how do these bans work and are they being implemented? People across the United States and around the world continue to speak up for their right to breathe clean, smoke-free air. That's why a growing number of cities, states, and countries are enacting laws that require all workplaces and public places to be smoke-free. In the United States, 24 states and the District of Columbia have smoking restrictions for private sector work sites, restaurants, and bars. On November the 8th, 2005, Washingtonians made a healthy choice by voting to pass Initiative 901. The initiative prohibits smoking in all restaurants and bars by amending the Bars, Restaurants, Bowling Centers, Skating Rinks, and Non-Tribal Casinos Act. The definition also includes private residences used to provide childcare, foster care, adult care, or similar social services. At least 75% of sleeping quarters in a hotel. There is no longer a scientific controversy that secondhand smoke is a killer. The Surgeon General report eliminates any excuse from any state or city for taking harmful measures to restrict smoking or permitting smoking in any indoor workplace. The good news is that beneficial effects of smoking bans appear to be fairly immediate, with declines in reported heart attack cases within 3 months. Dr. Myers encourages clinicians to support community smoking bans and other tobacco control measures, including tax increases on cigarettes, expanded cessation services, including telephone quit lines, and educational campaigns. So far, bans on smoking in public places and workplaces have been instituted in 32 states, many cities across the country. The United States increasingly institutes policies to protect non-smokers from secondhand smoke. Doctors say these efforts will yield great public health benefits in the form of reduced disease, disabilities, and deaths. Such laws may reduce healthcare costs, improve work productivity, and lower overall cost of labor in the community, thus protected, making the workforce more attractive for employers. In the U.S. state of Indiana, the Economic Development Agency included in its 2006 Plan for Acceleration of Economic Growth encouragement for cities and towns to adopt local smoking bans as a means of promoting job growth in communities. Now that we have a clear understanding of the dangers of public smoking and the health and financial risks associated with secondhand smoke, both to the economy and the individual alike, it is clear to see that there is a never-ending chain reaction of health effects and financial problems associated with secondhand smoke. The only logical answer is a total ban on smoking in public places. Smoking is your option, but the public has a right to breathe in clean, fresh air and good health. Even more, everyone has an economic responsibility to the country and the world. So the next time you light up a cigarette in a public area or have to vote on a non-smoking ban, remember my personal saying: smoking is optional, but breathing is not. Where to my ID? Lost my ID, dude. Alright.